We all love to see our dogs active and full of life, but for some, a condition called hip dysplasia can make even the simplest movements a struggle. Canine hip dysplasia is a complex, chronic condition that affects the hip joint. This arthropathy primarily affects where the femoral head meets the acetabulum of the pelvis, and is essential for smooth, pain-free movement. In hip dysplasia, this perfect fit is disrupted. The bones of the hip joint may be malformed, leading to joint laxity and instability. This causes abnormal wear and tear. Over time, this leads to inflammation, pain, and the development of osteoarthritis, a degenerative joint disease. This can significantly impact a dog's mobility and quality of life. But there's hope. By understanding hip dysplasia, we can take steps to prevent it, recognize the signs early, and provide the best possible care for our canine companions. Join me as I explore canine hip dysplasia, from its causes and symptoms to diagnosis and treatment options. Together, we can help our dogs live happier, healthier lives. Let's pinpoint where hip dysplasia actually resides in our furry friends. The hip joint is right where the leg connects to the body. It's like the base of the leg, and it's super important for smooth movement. Inside the joint, there's a ball that fits into a socket. When a dog has hip dysplasia, that ball and socket don't fit together quite right. It's like a puzzle piece that's slightly the wrong shape. This misfit causes the joint to be loose and wobbly, leading to all sorts of problems. To understand its location better, think of it this way: the hip joint is caudal to the lumbar spine, cranial to the stifle joint, that's the knee, and located on the lateral aspect of the body towards the outside. Hip dysplasia affects a very specific and crucial part of a dog's anatomy, impacting their ability to run, jump, and even walk comfortably. Hip dysplasia is a big deal, especially for our larger breeds. It's one of the most common problems they face, and it can really cramp their style. Imagine not being able to run, play fetch, or even walk comfortably. That's what hip dysplasia can do to a dog. It causes pain and makes it hard to move around. Treating hip dysplasia can be tricky. There's no magic cure, and it often involves a combination of things like medicine, special exercises, and sometimes even surgery. Many people don't realize that hip dysplasia starts when a dog is young, even a puppy. It's not just something that happens to older dogs, and it's not always caused by too much exercise. It's often because of how their bones grow. The good news is that we can do things to help prevent hip dysplasia, like making sure puppies get the right food and exercise, and by choosing parents who have healthy hips. So, how can you tell if your dog might have hip dysplasia? Well, there are some telltale signs to watch out for. Keep an eye on how your dog walks. Do they seem stiff? Do they limp or have trouble keeping up on walks? Sometimes dogs with hip dysplasia have a funny way of walking. They might hop like a bunny or waddle. You might even notice that they yelp or pull away when you touch their hips. This is a sign that the area is painful. If your dog seems less playful or less interested in running around, it could be because their hips are hurting. Hip dysplasia doesn't just affect the bones. It can also cause inflammation, which is like the body's way of reacting to injury. The inside of the joint can get irritated and swollen, kind of like when you sprain your ankle. This inflammation causes pain, makes the joint stiff, and can make it hard for your dog to move around comfortably. Inflammation can limit the joint's ability to move through its full range of flexion and extension, as well as adduction and abduction. If you notice your dog is having trouble moving, seems sore, or if their hip area feels warm or looks a bit swollen, it could be a sign of inflammation. It's important to let your vet know about these signs so they can help manage the inflammation and keep your dog feeling their best. If you suspect your dog has hip dysplasia, your vet will want to take a closer look. They'll start by physical examination of your dog. Your veterinarian will carefully palpate. Examine by touch the hip joints to assess for pain, sensitivity to touch, especially during flexion, extension, adduction, and abduction of the hip. Crepitus, any grinding or clicking sounds within the joint, suggesting cartilage damage. Range of motion, limitations in the normal range of motion of the hip. Muscle mass, checking for any atrophy of the muscles around the hip, particularly in the epaxial muscles and those of the affected pelvic limb. Gait analysis, observing the dog's gait for lameness, stiffness, or an abnormal gait pattern. X-rays are really important for seeing what's going on inside the joint. They can show if the ball and socket fit together properly and if there's any arthritis. X-rays ordered may be in standard views such as the ventrodorsal extended hip view, where the dog is positioned on its back with the hind limbs extended and rotated outwards. This view allows assessment of the femoral head and neck, acetabulum, and joint congruency. They may also order other views such as dorsal acetabular rim view helps evaluate the shape and integrity of the acetabular rim. Dorsolateral subluxation score assesses the degree of partial dislocation of the femoral head from the acetabulum. They may also order ultrasound views. Cranial and caudal views. These views provide different perspectives of the hip joint. The cranial view is taken from the head towards the tail, while the caudal view is taken from the tail towards the head. Lateral view. This view shows the hip joint from the side, helping to assess the dorsal and ventral aspects of the joint. Oblique views, these angled views, can help visualize specific areas of the hip joint in more detail. By utilizing a combination of these diagnostic tools, veterinarians can accurately diagnose hip dysplasia, assess its severity, and develop an appropriate management plan for your dog. By talking about hip dysplasia, we can help dog owners understand this condition and take steps to protect their furry friends. Early diagnosis and the right care can make a big difference in helping dogs with hip dysplasia live full and happy lives.